Hello, this is Philip Myers of PEMY Consulting. I'm the chair of the API 2000 Flow Certification Task Group. This task group was initiated by the main API 2000 committee to determine if there was a problem with the flow certification of venting devices such as pressure vacuum vent devices and emergency vent flow devices. These are important safety devices for storage tanks, so it's important that the process in place to certify the flow rates for the user is accurate and precise. Several years ago, when this process was initiated, it arose because some of the manufacturers had claimed that other manufacturers were putting out bad information in terms of these flow curves and accuracies and performance. So the task group was formed to look at this. We decided that the best way to deal with this was to actually do some voluntary and informal testing, which is what we did. The results were somewhat disappointing. There was a wide variation in the results. In fact, there was a problem with the certification process. Part 1, which is completed and available, is on the website, which will be on the next slide, so you can download it there. It provides complete background and information. Today we're talking about Part 2, which is the final work of this task group, at least at this point, and it points to a way forward to remedy the situation. We need to mention here that all of this information has been reported to the API 2000 Leadership Committee. So they are taking steps to look at what should be done. Do they get help from ASME, who does this routinely, or do we get funding so that we can establish a gold standard and those kinds of things? As I mentioned, there are 2 white papers, a lot of data, and all of the information is available here at this website. The problem with laboratory testing, or in our case, flow certification, is similar to any data analysis. You can see here that there's large scatter, tight scatter here on the right hand side. You got tight scattering, but this one is inaccurate because it's not close to the truth, which is represented by the bullseye. Here you have kind of large scatters, but these seem to be fairly accurate in terms of, if you were to take the average of these points, they look like they're pretty close to the bullseye. Now, our problem was different. We did not have a bullseye. We didn't have a gold standard because this was informal testing. We did the best we could do, but what it means is that we were shooting at a target that has no lines on it. And so that's another reason that I believe that the process for fixing these problems needs to continue. And I think it's also the opinion of the API 2000 Leadership Committee. In researching this work to see what we could do better, we found ISO 13528. This is a standard that's specifically for this problem of coordinating interlaboratory measurements and making sure people are getting good, accurate, precise readings. So any kind of food and drug or health safety type lab work would follow a process similar to this to make sure that the data is correctly being reported. What it requires is 3 things: a reference lab, which provides a gold standard, in other words, the bullseye for the data; a coordinating body. This is an independent organization, so in our case it might be API or ASME. And then, of course, the individual manufacturers in this case would be represented by these balloons. There's a protocol and algorithm that's needed to be implemented to use this type of a system. The ISO standard has 2 methods of reporting results. One of them is a statistical method. It uses a z-score, which is a statistical measurement protocol for whether or not you're acceptable in terms of your recorded measurements. And then there is a deviation method, a percent, where you vary from the gold standard by a certain amount. So there are basically two types of reports. Here is a z-score report, and let me point out what these axes are. These are the nominal orifice diameters. So we tested 2, 6, and 10-inch orifices. And on the right, these little bars, we tested 1, 2, 3, 4, 5 nominal inches of pressure differential. If you were participant A, you would know, you would get a plot that looks like this and shows the red points, which are your data, and then all this other data is sanitized. You would see the data, but you wouldn't see who did it. What this shows is you are high compared to the bulk of the data. You're skewed positive. You have a positive bias. The ISO standard sets an arbitrary 2 sigma as the z-score. I don't think that's necessarily correct. It's arbitrary, and that should be something that's debatable by the committee if they implement this. So the other method is the percent deviation report, and here you can see participant A is high, but they've exceeded the action limit, which is supposedly acceptable or unacceptable results, and you can see that in the 10-inch orifice they passed the action limit in all cases. On the 6-inch orifice at 5 inches, 4, 3, and 1 inch of water column they failed, and then in the 2-inch orifice they failed at the 2-inch differential. So this is what we've recommended to implement or start to review for the next phase of the flow certification work that we've undertaken. So at this point, there's nothing further the task group can do other than to wait for API 2000's leadership decisions. Thank you.